All right, we're talking about teeth straightening, one of the most popular and probably most common procedures in dentistry, and we have Dr. Brian Dunlap here to discuss this with us. Tell us about a lot of the ways you all are able to do this. I know the old school way is braces.
That's right, which still, the most common way I think that we do it. By the way, thanks for having me once again. The most common way we do braces, obviously, is the old school, or the straightening of the teeth, is the old school braces. The metal mouth that we're all used to seeing. I had them for about 3.5 years. It was a great high school experience. But, that's probably the most effective way to do exactly what you need to do, because when you're talking about straightening teeth, it's not just the teeth that we're straightening. It's actually, too, aligning the bones of the face.
Okay.
So, and there's a lot more of that goes on these days than used to in the old days, as far as just not only the teeth, but lining up your jaw. And
so are there procedures that perhaps address that a little bit more than braces, or just in a different way?
Well, I think they have things along with the braces, like we have palatal expanders and things we use a lot more. Back in the day when I was younger, they used to pull a lot of teeth, a lot of adult teeth to make room, and now we don't hardly ever do that anymore, which is a great...
our teeth.
Yeah, it's a great advancement. So we try to expand things and make more room for the teeth we have, and then straighten things up, and that's a lot more effective.
Okay, talk to me about Invisalign, because you see a lot of people wanting to go, maybe adults are getting, their teeth straightened and they don't want braces.
Right, exactly. Well, this is a really great way for adults, I think. For a lot of my patients and a lot of general dentists are doing a lot of Invisalign, because, Invisalign is great for some minor to moderate cases, right? We have kind of the example. That's the old school braces that we have on there.
Okay, but right here we have...
Right here we have these little trays, and they are very thin and flexible. They're really comfortable.
Right.
Sorry, I'm moving it around the camera. My bad, guys. But when you put them on, you can't even hardly tell that anybody's got these on. So when you wear these, and it's amazing how well the Invisalign works. You can really do some pretty moderate straightening with the Invisalign. And I found that my patients and the patients that get Invisalign love it.
Okay, it's not as invasive and perhaps not as obvious.
Yeah, you don't even really know. Patients can be doing Invisalign, and their friends and coworkers wouldn't even know they're doing it.
Okay,
so
quickly,
it's a nice one. Just
a few seconds. Sorry to cut you off, but can you share with people how do they know they're a candidate for one of these?
Well, it's basically a lot of times, sometimes braces is a big help if you have a real bite problem where it's causing you pain or discomfort or eating issues, but most of the time it's kind of choice. It's aesthetics that we're looking at, especially with the Invisalign and the adult braces.
All right. Well, incredible information there. Thank you, Dr.
Thanks for having me again.
Sure thing. It's a blast.